Hi everybody, this is Dr. Michael Vasky here at the Parker Walmart Vision Center in Parker, Colorado. And one of the things that gets asked of me is to describe the condition of glaucoma. Sometimes we hear of different things happening family members may have this disease but they just don't know what it is. So what glaucoma is, it refers to a category of eye disorders associated with the buildup of internal eye pressure, also known as intraocular eye pressure. And if that is too much elevated, it can damage the eye's optic nerve that transmits the visual information to the brain. With untreated glaucoma, you might eventually notice a decreased ability to see the edges of your vision. It's also known as your peripheral vision, and then which goes unnoticed. So, in fact, some of this glaucoma is called a silent thief of sight, and what that does is it slowly progresses with no outward symptoms. There's no pain, and there's no vision loss. And because everybody notices the central vision more so than we do our peripheral vision. For this reason, glaucoma often progresses undetected until the optic nerve already has been damaged with varying degrees of vision loss. One other type of glaucoma is called acute angle closure glaucoma. These symptoms, actually, you can get symptoms that occur suddenly, in which you get sudden vision loss, blur around lights, and very high eye pain. You can even start to feel or get nauseous and vomit with this. So when this is brought on, you usually are an emergency case. So you usually go to the emergency room, or you come and see myself or another type of eye care provider. So what do we do about glaucoma, and how do we diagnose it? So what we do during the eye exam is we do screenings. We need to check your intraocular pressure. So there's a couple of different ways that we check your eye pressure. One is we take numbing drops, and then we put a small probe gently on the surface of your eye, and then that also detects the eye pressure. One other way to detect the eye pressure is we do a little puff of air to the eyes, and that's what a lot of people almost dread, is the little puff of air. And what we're going to detect is the amount of fluid that is building up inside the eye. So typically there's a range between 10 and 20, and so that if that falls in within those ranges, we don't have to do further testing. But once we get over there 20, then there's a red flag that goes up, and so what we need to do is do more testing. If we get over 30, then our risk of glaucoma gets even higher. So now we need to see what we need to do to get this pressure down. And most times the treatment that we use to get the eye pressure down is eye drops. And the more popular drops, the ones that work really well, are drops that work on the drainage valves that make the pressure go up or down. And those drops are really nice to use because you only have to use them once a day, and use them at night to lower the pressure. Very small side effects with those versus some of the newer eye drops for glaucoma. So now one other way that we help determine if you have glaucoma is a visual field test. And visual field testing involves a couple of different ways. One is we use a visual field tester, which helps to detect any faulty neurons affecting the side of the vision or your peripheral vision. So one visual field testing is you put your head in a bowl, and there's little lights that go off, and you're visual tested. Your visual field is tested that way. Another way is to detect visual field loss is these little shimmeries of lights. It's called a frequency doubling test. So those are the two main ways to test your visual field test, or visual field function. Another way to make sure that the eye is working properly, or another way to diagnose glaucoma, is we do a measurement of the measuring the structures that make the fluid drain throughout your eyes, and that test is called gonioscopy. And that's a test that we put a little microscope on your eye, and that helps to look at all the small structures that help cause the drainage of your eye. And so one of the ways that we're going to test your eyes is with visual field testing, and we're going to do gonioscopy. Another way that we use or detect glaucoma is we actually measure the thickness of your cornea. We have found there's been a lot of tests going out that if your corneas are too thick or too thin, you get some very faulty readings, kind of like false positives, so that we can help manage your eye pressure. Sometimes if the eye pressures have been elevated for so long, then we have to do all these little tests, and we found out that your actual corneal pressure or corneal thickness was too high or too thick, then your eye pressures were reading too high, and vice versa. If your eye thickness or corneal thickness was too low, then you have a different type of reading. So there's different ways that we can help determine if you have glaucoma. So it's a very, let's say, tedious way of detecting if you have glaucoma, but tests necessary to make sure that you have glaucoma or you do not have glaucoma. One of the things that we'll ask during the testing is if there's any family members that have glaucoma. Sometimes we've heard of grandparents that thought they had glaucoma, but they actually had cataracts. So that's one way that we have to make sure that it's not genetic in nature. So that's a little bit overview about what glaucoma is. So it's a very important test that we have to do on an annual basis, and because it's no outward symptoms with glaucoma, and so that's really tough to manage, because people say, oh, my eyes feel good, because you can have very good vision and also still have glaucoma. So it's a test that we should do annually, even for children, because there is some cases of infantile glaucoma or genetic nature glaucoma. So hope that helps with your questions about glaucoma. And if you have any more questions, give us a call at the phone number below, or check us on the web at the address below. And so we will see you on the other side. Thank you.